Welcome. This training is about psychiatric and substance use disorders in young people. We'll learn how to identify the symptoms of these disorders, and we will look at how these disorders can impact a young person's life. Sadly, more and more children and teenagers are struggling with their mental health, and they are using drugs and alcohol at increasingly young ages. This is why it's so important for us to be informed. We need to know what to look for, and we need to know how to help. In this training, we will be covering a lot of important information. We will be talking about the signs and symptoms of different disorders. Plus, we will look at how these disorders can affect a child's behavior and their ability to function in everyday life. By the end of this training, you will have a better understanding of these complex issues. You'll be better equipped to identify and support young people who may be struggling. Let's get started by thinking about the scope of the problem. Psychiatric disorders and substance use disorders don't discriminate. They can affect young people from all walks of life. It's vital that we approach this topic with sensitivity, compassion, and a commitment to understanding. Our goal is to create a safe and supportive environment for all young people. And that starts with knowledge. The more we know about these disorders, the better equipped we are to make a real difference in the lives of the children and families we serve. Identifying the signs of psychiatric and substance use disorders in young people is not always easy. Often, these disorders manifest in ways that can be mistaken for typical adolescent behavior. A teenager might seem withdrawn and irritable, but is it just a phase, or is it something more? We're going to learn about the specific signs and symptoms of various psychiatric and substance use disorders. We will discover the difference between what's considered within the range of normal behavior for children and adolescents, and what might be a red flag. Early identification is key. The sooner we can recognize potential problems, the sooner we can intervene and provide support. It's also important to remember that psychiatric and substance use disorders often go hand in hand. A young person struggling with depression or anxiety might turn to drugs or alcohol as a way to cope with their difficult emotions. By understanding the interplay between these disorders, we can develop more effective treatment plans that address the underlying issues. Throughout this training, we will emphasize the profound impact that these disorders can have on a young person's life. From their academic performance to their relationships with family and friends, these disorders can touch every aspect of a young person's world. Our goal is to equip you with the knowledge and tools you need to support young people. We want to help them navigate these challenges and build brighter futures. Let's start by exploring two of the most common psychiatric disorders in children: depression and anxiety. These disorders can manifest differently in children than they do in adults. So it's crucial to understand the unique ways these conditions present in younger age groups. Depression in children often presents as persistent sadness, irritability, or a loss of interest in activities they once enjoyed. A child experiencing depression might withdraw from social interaction, complain of physical symptoms like headaches or stomach aches, or exhibit changes in appetite and sleep patterns. It's important to remember that children may not always have the vocabulary to express their feelings verbally, so their distress might manifest through behavioral changes. Anxiety, on the other hand, often manifests as excessive worry, fear, or apprehension. A child struggling with anxiety might be easily startled, have difficulty relaxing, or avoid specific situations or places that trigger their anxiety. Physical symptoms like headaches, stomach aches, or rapid heartbeat are also common in children with anxiety disorders. Recognizing these signs early on is crucial for providing timely support and intervention. Untreated depression and anxiety can have a significant impact on a child's social, emotional, and academic development. It's essential to create a safe and supportive environment for children to discuss their feelings and seek help without stigma. Remember, every child is different, and there's no one-size-fits-all approach to identifying and addressing these disorders. By staying vigilant and informed, we can make a positive difference in the lives of children struggling with depression and anxiety. Moving on, let's delve into two other common psychiatric disorders that affect children: bipolar disorder and attention deficit hyperactivity disorder, ADHD. While these disorders share some overlapping symptoms, they have distinct characteristics that require different approaches to management and treatment. Bipolar disorder, previously known as manic depressive illness, is characterized by extreme shifts in mood, energy, and activity levels. Children with bipolar disorder experience periods of intense highs, known as mania, and lows, known as depression. During manic episodes, children might exhibit increased energy, racing thoughts, impulsive behavior, and a decreased need for sleep. In contrast, during depressive episodes, they may experience feelings of sadness, hopelessness, loss of interest, and changes in appetite and sleep patterns. ADHD, on the other hand, is characterized by persistent inattention, hyperactivity, and impulsivity. Children with ADHD often struggle to focus, follow instructions, and stay organized. They may fidget, squirm, talk excessively, and interrupt others. These symptoms can significantly impact a child's academic performance, social interactions, and family life. It's important to note that not all children who exhibit these symptoms have bipolar disorder or ADHD. A comprehensive evaluation by a qualified mental health professional is crucial for accurate diagnosis and treatment. Early identification and intervention are essential for helping children with bipolar disorder and ADHD manage their symptoms and reach their full potential. Treatment often involves a combination of medication, therapy, and educational support. By understanding the unique challenges faced by children with these disorders, we can create supportive environments that foster their well-being and success. In this section, we'll explore 3 distinct disorders that can significantly impact a child's behavior, emotions, and relationships: oppositional defiant disorder, reactive attachment disorder, and post-traumatic stress disorder. Oppositional defiant disorder, or ODD, is characterized by a pattern of angry and irritable mood, argumentative and defiant behavior, and vindictiveness. Children with ODD often have frequent temper tantrums, deliberately annoy others, and blame others for their mistakes. They may have difficulty controlling their emotions and struggle with authority figures. Reactive attachment disorder, or RADI, is a rare but serious condition that develops in children who have experienced severe neglect or deprivation in early childhood. Children with RAD have difficulty forming healthy attachments with caregivers, and may exhibit withdrawn, emotionally detached, or inappropriately affectionate behavior. They may struggle to seek comfort when distressed and have difficulty regulating their emotions. Post-traumatic stress disorder, or PTSD, can develop in children who have experienced or witnessed a traumatic event, such as abuse, violence, natural disasters, or serious accidents. Children with PTSD may re-experience the trauma through nightmares, flashbacks, or intrusive thoughts. They may avoid reminders of the trauma, experience emotional numbing, have difficulty sleeping, and be easily startled. Addressing these complex disorders requires a multifaceted approach that considers the child's individual needs and experiences. Therapy, medication, and family support can be crucial components of treatment. By understanding the underlying causes of these disorders and providing appropriate interventions, we can help children heal, build resilience, and thrive. As we move from childhood into the teenage years, we encounter a new set of challenges: substance use disorders. Adolescence is a period of significant physical, emotional, and social development. It's a time when young people are naturally curious, testing boundaries, and seeking independence. Unfortunately, these factors also make them more vulnerable to experimenting with drugs and alcohol. The teenage brain is still developing, particularly the prefrontal cortex, which is responsible for decision-making, impulse control, and long-term planning. This means that adolescents are more likely to engage in risky behavior, including substance use, without fully understanding the potential consequences. Additionally, peer pressure can be a powerful influence during adolescence. Young people often feel the need to fit in and may be more likely to experiment with substances if their friends are doing so. It's essential to understand the underlying reasons why adolescents might turn to substance use. Some teens may use drugs or alcohol as a way to cope with stress, anxiety, depression, or other mental health issues. Others might be seeking excitement, a sense of belonging, or a way to escape from difficult emotions or situations. By understanding the unique vulnerabilities of adolescence, we can develop more effective prevention and intervention strategies to address substance use disorders. Let's delve into some of the most common substance use disorders affecting adolescents today. Alcohol use disorder, opioid use disorder, stimulant use disorder, and cannabis use disorder. Each of these disorders presents with its own set of symptoms, but they all share a common thread: the inability to control substance use despite negative consequences. Alcohol use disorder, often referred to as alcoholism, is characterized by a compulsive need to drink alcohol, even when it causes problems in a person's life. Adolescents with alcohol use disorder might engage in binge drinking, experience withdrawal symptoms when they try to stop drinking, or continue to drink, even though it's causing problems at school, home, or in their relationships. Opioid use disorder has become a significant public health crisis in recent years, affecting people of all ages, including adolescents. Opioids are a class of drugs that include prescription painkillers like OxyContin and hydrocodone, as well as illegal drugs like heroin. These drugs are highly addictive and can lead to overdose and death. Stimulant use disorder involves the misuse of stimulants, such as cocaine, methamphetamine, and prescription stimulants like Adderall and Ritalin. These drugs increase alertness, attention, and energy levels, but they can also lead to anxiety, paranoia, heart problems, and addiction. Cannabis use disorder, while becoming increasingly common, is often misunderstood. Many people believe that marijuana is harmless, but it can be addictive and have serious consequences, especially for adolescents whose brains are still developing. Regular marijuana use can impair memory, attention, and learning abilities, and increase the risk of developing mental health problems later in life. Recognizing the signs of substance use disorder in adolescence can be challenging, as many of the symptoms can mimic typical teenage behavior. However, there are some red flags to watch for that might indicate a problem. Changes in behavior are often the first sign that something is amiss. An adolescent struggling with substance use might become withdrawn, secretive, or irritable. They might lose interest in activities they once enjoyed, experience a decline in their grades, or start hanging out with a new group of friends. Physical changes can also be indicative of substance use. Adolescents might experience sudden weight loss or gain, have bloodshot eyes, or appear tired or disheveled. They may also have changes in their sleep patterns, sleeping too much or too little. Another warning sign is a sudden change in an adolescent's social circle. They may start spending time with people who are known to use drugs or alcohol, or they might become increasingly isolated from their previous friends and family. If you suspect an adolescent is struggling with substance use, it's essential to approach the situation with compassion and understanding. Avoid accusations or judgmental language, as this can make the young person defensive and less likely to open up. Instead, express your concern and let them know that you're there to support them. We've discussed the common signs and symptoms of various psychiatric and substance use disorders in young people. Now let's examine the profound impact these disorders can have on an individual's ability to function in their daily lives. Imagine a stone being tossed into a still pond. The ripples spread outward, affecting the entire ecosystem. Similarly, when a child or adolescent is grappling with a mental health or substance use disorder, the effects are felt far and wide, impacting their schoolwork, their relationships, and their overall well-being. For a young person already navigating the complexities of childhood or adolescence, the added burden of a disorder can feel overwhelming. A child struggling with depression may find it impossible to concentrate in class, leading to falling grades and a sense of inadequacy. An adolescent battling anxiety might avoid social situations, missing out on valuable interactions with peers and experiences that contribute to their development. Substance use disorders can further compound these difficulties, creating a vicious cycle that can be difficult to break. A teenager using drugs or alcohol as a coping mechanism might find that their substance use only exacerbates their existing mental health issues, leading to a downward spiral. The ripple effect of these disorders can touch every aspect of a young person's life, from their physical health to their emotional well-being. It's essential to remember that the impact of these disorders extends far beyond the individual. Family members, caregivers, and friends often find themselves navigating uncharted territory, unsure of how to best support their loved one. Let's take a closer look at some of the specific challenges that young people with psychiatric and substance use disorders might face in their daily lives. School can become a significant source of stress and anxiety for these children. A child with ADHD might struggle to sit still and pay attention in class, leading to frustration for both the child and their teacher. A teenager with social anxiety might avoid participating in group projects or speaking up in class, hindering their academic progress and limiting their opportunities for growth. Substance use can further derail a young person's education, leading to absenteeism, declining grades, and even expulsion. Relationships with family and friends can also suffer. A child with oppositional defiant disorder might engage in frequent arguments and power struggles with parents, creating tension and conflict within the family unit. An adolescent struggling with depression might isolate themselves from friends and loved ones, withdrawing into themselves and pushing away those who care about them most. Substance use can create a wedge between teenagers and their families, leading to broken promises, dishonesty, and a breakdown of trust. The impact on the individual is undeniable, but it's crucial to recognize the toll these disorders can take on family dynamics as well. Family life can be significantly impacted when a child or adolescent is struggling with a psychiatric or substance use disorder. Parents and caregivers often find themselves thrust into the role of caregiver, advocate, and disciplinarian, all while trying to maintain a sense of normalcy within the family unit. The emotional and financial strain of caring for a child with a mental health or substance use disorder can be overwhelming. Parents may have to miss work to attend therapy appointments, manage behavioral crises, or deal with the aftermath of their child's substance use. Siblings of children with these disorders may also experience a range of emotions, including resentment, confusion, and fear. They might feel neglected or overlooked as their parents' attention is understandably focused on their siblings' needs. It's essential for families to have access to support and resources to help them navigate these challenges. Family therapy can provide a safe and supportive environment for family members to communicate openly, address conflicts, and develop coping strategies. Support groups can also be invaluable, connecting families with others who understand what they're going through and offering a sense of community and shared experience. Remember, families are not alone in this journey. There are resources available to help them navigate the challenges of psychiatric and substance use disorders and support their loved ones on their road to recovery. Let's take what we've learned and apply it to a real-life scenario. Meet Alex, an 8-year-old boy who loves Legos, soccer, and reading stories about dinosaurs. Alex is a bright and imaginative child, but lately he's been struggling. He's constantly worried, often about things that seem insignificant to others. He worries about his grades, about making mistakes, and about things that might happen in the future. His parents first noticed his anxiety when he started having difficulty sleeping. He'd lie awake at night, worrying about everything from monsters under the bed to upcoming tests at school. His anxiety began to spill over into his school day. He found it hard to concentrate in class, and his teacher noticed he was often fidgeting, tapping his feet, and getting out of his seat. Alex was also having a hard time making friends. He wanted to play with the other children, but his worries and inability to sit still often made it difficult for him to join in games and activities. He would often get frustrated and upset, leading to outbursts and tantrums. Recognizing that something was wrong, Alex's parents sought help from a mental health professional. After a comprehensive evaluation, Alex was diagnosed with generalized anxiety disorder, or GAD, and attention deficit hyperactivity disorder, or ADHD. Alex's diagnosis was a relief for his parents. Finally, they understood what was going on and could start getting him the help he needed. The therapist recommended a multifaceted treatment plan that included both therapy and medication management. Alex began attending weekly therapy sessions, where he learned coping mechanisms for managing his anxiety, such as deep breathing exercises and positive self-talk. He also worked with the therapist on developing organizational skills and strategies for improving his focus. In addition to therapy, Alex's doctor prescribed a low dose of medication to help manage his ADHD symptoms. The medication helped to reduce his impulsivity and improve his attention span, making it easier for him to succeed in school and interact with others. Alex's parents were instrumental in his recovery. They worked closely with the therapist and teachers to create a supportive environment at home and at school. They established consistent routines, provided clear expectations, and offered praise and encouragement for his efforts, no matter how small. With time, therapy, medication, and the unwavering support of his family and teachers, Alex began to thrive. His anxiety lessened. He was able to focus better in school, and he even made some good friends. Alex's story is a testament to the power of early identification, appropriate intervention, and a supportive network in helping children overcome the challenges of mental health disorders. Let's shift our focus now to the challenges of substance use disorder in adolescence through the story of 17-year-old Mia. Mia always excelled in school. A bright and athletic student, she had a close-knit group of friends and dreamed of becoming a veterinarian. However, during her sophomore year, Mia's life took a sharp turn. A car accident left her with a painful back injury. Prescribed painkillers to manage the discomfort, Mia initially found relief. However, as the weeks wore on, she noticed she needed higher doses to achieve the same effect. The pills, once a solution for her pain, began to cast a long shadow over her life. Mia started withdrawing from her usual activities. Soccer practice became too strenuous, and she no longer found joy in spending time with friends. Her grades, once a point of pride, began to slip as she struggled to focus in class. She became increasingly isolated, withdrawing into herself and pushing away those who cared about her most. At home, the tension was palpable. Her once sunny disposition turned irritable and withdrawn. She clashed with her parents, who were bewildered by her sudden change in behavior. Unbeknownst to them, Mia had begun to purchase pills illegally, desperate to maintain the feeling of numbness they provided. She was caught in the throes of opioid addiction, her life slowly unraveling. Section 2. A Glimmer of Hope. Seeking help and finding recovery. Mia's parents, heartbroken by their daughter's transformation, realized they needed professional help. They sought out a therapist specializing in addiction, and Mia reluctantly agreed to attend sessions. The therapist, with warmth and compassion, helped Mia understand the grip opioid addiction had on her life. He explained the science behind addiction, emphasizing that it was a disease, not a moral failing. He assured her that recovery was possible, but it would require courage, commitment, and a strong support system. Mia's parents, initially overwhelmed by the situation, became pillars of strength throughout her recovery journey. They attended family therapy sessions, learning how to best support their daughter and address the impact her addiction had on the entire family. They discovered local support groups, finding solace and guidance from other families who understood the complexities of addiction. Mia, with the support of her therapist, parents, and a medication-assisted treatment program, began the arduous journey of reclaiming her life. It wasn't easy. There were setbacks and moments of doubt. But with each hurdle overcome, Mia gained strength and hope. She reconnected with her love for animals, volunteering at a local animal shelter. She slowly rebuilt relationships with her parents and a few close friends who stood by her side throughout her ordeal. Mia's story, though fraught with challenges, offers a powerful message of resilience, the importance of early intervention, and the transformative power of family support in the face of addiction. Section 1. Addressing the underlying issues. A multifaceted approach. Now that we've explored the complexities of psychiatric and substance use disorders in young people, let's turn our attention to practical strategies for managing symptoms and promoting recovery. It's important to remember that there's no one-size-fits-all approach to treatment. Each child and adolescent is unique, and their treatment plan should be tailored to their individual needs and circumstances. However, some general principles guide effective treatment for these disorders. One crucial aspect is addressing the underlying issues contributing to the disorder. This might involve therapy to help the young person understand and manage their emotions, develop coping mechanisms for stress, or address any trauma they may have experienced. Cognitive behavioral therapy, or CBT, is a particularly effective form of therapy for many psychiatric disorders. CBT helps individuals identify and change negative thought patterns and behaviors that contribute to their distress. For younger children, play therapy can be a valuable tool, allowing them to express their emotions and work through challenges through play. In some cases, medication may be recommended as part of the treatment plan. Medications can help manage symptoms such as anxiety, depression, hyperactivity, or impulsivity, making it easier for the young person to engage in therapy and other aspects of their life. Section 2. Tailoring treatment to individual needs. A collaborative effort. Effective treatment goes beyond therapy and medication. It requires a collaborative effort involving the young person, their family, and a team of professionals. Open communication among all parties is essential to ensure everyone is on the same page and working towards the same goals. School-based interventions and support can also play a vital role in a young person's recovery. Teachers and school counselors can work with a child to create a supportive learning environment, provide accommodations as needed, and monitor their progress. Family therapy can be invaluable in helping families understand the disorder, develop communication skills, and address conflicts that may arise. It also provides a safe space for family members to express their own feelings and receive support. For adolescents struggling with substance use disorders, specialized treatment programs are often necessary. Detoxification programs can help manage withdrawal symptoms safely and comfortably. Medication-assisted treatment, or MAT, can reduce cravings and withdrawal symptoms, making it easier to abstain from substance use. Counseling and behavioral therapies address the underlying causes of addiction and help individuals develop healthy coping mechanisms. Peer support groups, such as Alcoholics Anonymous or Narcotics Anonymous, can provide a sense of community and accountability, connecting individuals in recovery with others who understand their struggles. Section 1. A call to action. Empowering ourselves to support young people. We've covered a lot of ground in this training, exploring the complexities of psychiatric and substance use disorders in children and adolescents. We've delved into the symptoms, the impact on daily life, and the strategies for managing these disorders. Now, as we conclude, it's essential to reflect on the key takeaways, and most importantly, how we can apply this knowledge to make a real difference in the lives of young people. First and foremost, remember that early identification is crucial. By recognizing the signs and symptoms of these disorders, we can intervene sooner, providing support and resources when they're needed most. Don't hesitate to voice your concerns if you notice a child or adolescent struggling. Your willingness to reach out could be life-changing. Secondly, approach these issues with compassion, understanding, and a commitment to reducing stigma. Mental health and substance use disorders are not character flaws or signs of weakness. They are medical conditions that require professional help and support, just like any other health concern. Finally, remember that recovery is possible. With appropriate treatment, support from loved ones, and a belief in their own resilience, young people can overcome these challenges and live full and meaningful lives. Let's continue to educate ourselves, challenge stigma, and advocate for policies and practices that support the mental health and well-being of all young people. By working together, we can create a brighter future for the next generation.